What is the primary mechanism by which CPB contributes to coagulopathy? A. Platelet aggregation due to blood oxygenation. B. Activation of the complement system. C. Consumption of clotting factors and platelets. D. Increased thrombin generation. Answer: C. Consumption of clotting factors and platelets. Explanation: during CPB, the contact of blood with artificial surfaces activates the coagulation cascade, leading to consumption of clotting factors and platelet depletion. This can cause coagulopathy, increasing the risk of both bleeding and thrombosis during and after surgery. Which of the following can contribute to liver injury during cardiopulmonary bypass? A. Low-dose diuretics. B. Decreased splanchnic blood flow. C. High-dose vasopressor use. D. Hyperventilation. Answer: B. Decreased splanchnic blood flow. Explanation: decreased splanchnic blood flow during CPB can lead to hepatic congestion and ischemia, contributing to liver dysfunction. This is especially important when there is prolonged hypoperfusion or low systemic blood pressure during the procedure. Which of the following strategies is least likely to reduce the incidence of postoperative delirium after CPB? A. Minimizing duration of CPB. B. Using a closed-loop anesthetic delivery system. C. Maintaining normal glucose levels during surgery. D. Providing postoperative analgesia with opioids. Answer: D. Providing postoperative analgesia with opioids. Explanation: opioids may contribute to postoperative delirium due to their effects on the central nervous system. While minimizing CPB duration and maintaining glucose control are protective, opioid use should be carefully managed to reduce the risk of delirium. Which of the following is a known consequence of significant hemolysis during CPB? A. Hyperkalemia and arrhythmias. B. Hypocalcemia and muscle spasms. C. Hyperglycemia and insulin resistance. D. Hypotension and shock. Answer: A. Hyperkalemia and arrhythmias. Explanation: hemolysis during CPB releases free hemoglobin, which can bind to nitric oxide, impairing vasodilation and leading to vascular dysfunction. Additionally, potassium is released from red blood cells, leading to hyperkalemia, which can precipitate arrhythmias. Which of the following factors is most likely to lead to postoperative acute kidney injury, AKI, after CPB? A. High urine output during surgery. B. Short duration of CPB. C. Maintenance of adequate cardiac output during surgery. D. Use of large volumes of crystalloid fluids during surgery. Answer: D. Use of large volumes of crystalloid fluids during surgery. Explanation: excessive crystalloid administration can lead to fluid overload, which increases the risk of acute kidney injury, AKI, by causing renal congestion and impaired renal function. This is particularly concerning in patients with pre-existing kidney dysfunction or those who are older. What is the primary cause of cognitive dysfunction following CPB in the elderly? A. Dehydration. B. Microemboli and cerebral ischemia. C. Hypertension during surgery. D. Hypoglycemia. Answer: B. Microemboli and cerebral ischemia. Explanation: in elderly patients, microemboli and cerebral ischemia due to poor perfusion or embolization during CPB are the primary causes of cognitive dysfunction, including delirium and postoperative cognitive dysfunction, POCD. This is more common in older patients due to age-related vascular changes. What is the most common cause of gastrointestinal injury during CPB? A. Infection from contaminated surgical instruments. B. Mesenteric ischemia due to low blood flow. C. Hepatic dysfunction leading to bile obstruction. D. Direct surgical trauma to the intestines. Answer: B. Mesenteric ischemia due to low blood flow. Explanation: mesenteric ischemia occurs during CPB due to reduced splanchnic blood flow, particularly during periods of low perfusion pressure. This can lead to gut mucosal injury, intestinal ischemia, or even gut necrosis in severe cases. Which of the following is a major contributor to cerebral injury during cardiopulmonary bypass? A. High flow rates during perfusion. B. Microembolism from the CPB circuit. C. Hyperglycemia during surgery. D. Elevated arterial blood pressure during weaning from CPB. Answer: B. Microembolism from the CPB circuit. Explanation: microembolism, such as air or thrombotic particles, is a significant cause of cerebral injury during CPB. These emboli can lodge in cerebral vasculature, causing ischemic damage to brain tissue, leading to neurological deficits such as stroke or cognitive dysfunction. Which of the following is most associated with increased risk of renal injury during CPB? A. Use of non-pulsatile flow. B. Higher doses of corticosteroids. C. Low-volume hemodilution. D. High blood pressure during surgery. Answer: A. Use of non-pulsatile flow. Explanation: non-pulsatile flow during CPB has been linked to increased risk of renal injury. Pulsatile flow better mimics normal physiological conditions, leading to enhanced renal perfusion and reduced chances of acute kidney injury, AKI, during CPB. What is a primary mechanism of inflammation during CPB that contributes to multiple organ damage? A. Activation of the intrinsic coagulation pathway. B. Release of pro-inflammatory cytokines and complement activation. C. Breakdown of platelet aggregates. D. Endothelial hyperplasia due to shear stress. Answer: B. Release of pro-inflammatory cytokines and complement activation. Explanation: CPB activates an inflammatory response involving the complement system and pro-inflammatory cytokines. This cascade contributes to endothelial injury, vascular permeability, and tissue damage, leading to organ dysfunction, especially in the lungs, kidneys, and heart.